Today we're going to be talking a little bit more about masks. There are many different types and shapes of masks, and as you can see in these pictures, these are just some of the P2 or N95 masks available. And to answer a quick question, what the difference is between P2 and N95, or you may have also seen KN95, the difference is the way they're assessed and the countries that assess them. So P2 are assessed to Australian and European standards. N95 is assessed to American standards, and KN95 is assessed to Chinese standards. So for the purposes of our masks, P2 or N95 offer the same level of protection and meet Australian standards. You might think that masks basically work like a sieve by capturing particles larger than the filter holes, but still allowing smaller particles through. Actually, masks don't work like a fly screen, which stops insects of a certain size getting through. Masks work more like a spider web, where they are able to capture different sized insects as long as they hit the fibers and stick. This is a close-up picture of the fibers of a mask. They are a random weave of fibers which captures the particles, and can you see the little red dots on the picture for an example? The horizontal wavy lines of this picture represent the fibers of a mask. The larger particles on the left of the picture move in a straight line, and because of the random weave of the mask fibers, they're almost certain to hit a fiber and stick. The smallest particles on the right side of this picture bounce around and move more randomly through the air. Again, because of the random weave of the fibers of the mask, they're almost certain to hit a fiber and stick. The middle-sized particles are the most difficult to capture as they move with the air currents and can move around the fibers. P2 or N95 masks are able to deal with this problem because, as well as having that random weave, they are also electromagnetically charged fibers which attract the particles with their charge. Think static electricity. N95 means that the mask is able to capture at least 95% of these middle-sized or most difficult particles. So when should you change your mask? Actually, the longer you wear your mask under certain conditions, the better it works because less and less particles are able to get through to you. So you do need to change your mask if it becomes wet or damaged. If there's breathing resistance, so you've worn your mask for a few hours and then you start to notice it's a bit harder to pull the air through and breathe through the mask. This usually means that the mask is full. So all those spaces in the mask are now full of those little particles. Also, if you enter or leave the break room, and also you need to change your masks after leaving a room or an area where droplet or airborne precautions are in place. For example, COVID-19 or influenza suspected or positive residents. It is interesting to note the difference between surgical masks and P2 or N95 masks. A surgical mask can help reduce the burden of particles in the environment. They do this by helping to capture a person's respiratory particles as they talk, cough, or sneeze. As the fit of a surgical mask allows for a lot of airflow around the mask, only a small amount of the air that you breathe through the mask is actually being filtered. This means they're not filtering the air that you breathe, and you're still susceptible to COVID-19, influenza, and any other respiratory viruses. Surgical masks can also protect the wearer from splashes entering their mouth or nose. For example, if somebody's standing in front of you and sneezes in your direction. We need to wear well-fitting P2 N95 masks for particle filtration and protection against these viruses. The biggest influence on how well your masks work is how well you wear it and how well the mask fits you. If a mask isn't fully sealed on your face, air that you're trying to filter can just bypass the mask entirely. Here are some examples of factors that affect the fit of the mask. Facial hair, any dental work. So if you start wearing dentures, it changes the shape of your face and therefore you might need to wear a different mask. Other PPE you're wearing that might create a little barrier between the mask and your face. How good your fitting skills are. So makeup, if it's still wet on your face, it can not allow the seal to happen properly against your face. And if you lose weight or gain weight, again, that changes the shape of your face and you might need to be wearing a different type of mask. You need to ensure that your hair is secured back. So any hair that gets between the mask and your face will not allow for a proper seal and will allow air containing virus particles to come through. Again, as previously mentioned, any hair between the face and the mask will not allow for a proper seal. And because of this, you need to be clean shaven to be wearing a P2 or N95 mask correctly. I'm going to show you some different videos now on how to fit the different shaped N95 masks.
To don the respirator, remove the respirator from its packaging and inspect all respirator components for damage prior to use. Unfold the respirator and hold it with both. To don the respirator, remove the respirator from its packaging and inspect all respirator components for damage prior to use. Unfold the respirator and hold it with both hands with the metallic strip facing up. Fully open both panels of the respirator to form a cup shape with straps hanging below the hand. Cup the respirator in one hand with fingertips positioned at nose piece. Place the respirator against your face. Position the respirator under the chin with the nose piece across the bridge of your nose and mouth. Keeping one hand on the respirator, pull the bottom strap over your head, then position it around the back of your neck and below your ears. Pull the top strap over the top of your head and rest it high on the crown of your head. The straps must not be twisted. Adjust the straps. Then adjust the respirator at the chin and cheeks. Using both hands, mold the nose clip to the shape of your nose bridge by pushing inwards while moving your fingertips down both sides of the nose piece. Always use two hands when moulding the nose piece. Pinching with one hand may result in improper fit and less effective respirator performance. Conform the nose piece across the bridge of your nose by firmly pressing down with your fingers. Make sure that hair, facial hair, jewellery and clothing are not between your face and the respirator, as they will interfere with the fit. Compress the respirator to ensure a seal across face, cheeks and the bridge of nose. Continue to adjust the respirator and secure the edges until you feel you have achieved a close fit. Once fitted, perform the fit check. This type of respirator requires close attention to the process of fit checking. To fit check an N95 foldable respirator, place both hands over the respirator, taking care not to disturb its fit. Gently place hands around the edge to feel any air escaping when the fit check is assessed. Take a deep breath and hold your breath for a few seconds, making sure the respirator collapses inward as you inhale. Then exhale. To don the mask, remove the respirator from its packaging and inspect all respirator components for damage prior to each use. Separate the edges of the respirator to fully open it. Slightly bend the nose wire to form a gentle curve. Hold the respirator upside down to expose the two headbands. Using your index fingers and thumbs, separate the two headbands. While holding the headbands with your index fingers and thumbs, cup the mask under your chin. Pull the headbands up over your head. Release the lower headband from your thumbs and position it at the base of your neck. Position the remaining headband on the crown of your head. The sequence of applying straps can vary, but the end position of straps remains most important. Conform the nose piece across the bridge of your nose by firmly pressing down with your fingers. Continue to adjust the respirator and secure the edges until you feel you have achieved a good facial fit. Make sure that hair, facial hair, jewellery and clothing are not between your face and the respirator, as they will interfere with the fit. Inhale and exhale sharply. The respirator should collapse slightly upon inhaling and expand upon exhaling. The wearer should not feel any air leaking between the face and the respirator. If the respirator does not collapse and expand, or if air is leaking out between the wearer's face and the respirator, then this is not a good facial fit. The wearer should readjust the respirator until the leakage is corrected. Remove the respirator from its packaging and inspect all respirator components for damage prior to each use. With reverse side up and using the tab, hold with the straps facing upwards. Fully open the top and bottom panels, bending the nose piece around your thumb at the centre of the foam. Make certain the bottom panel is unfolded and completely opened. Cup respirator in one hand with open side towards face. Place the respirator on your face so that the foam rests on your nose and the bottom panel is securely under your chin. Hold respirator under chin with nose piece up and pull straps overhead. Pull the top strap over your head and position it high on the back of the head. Pull the bottom strap over your head and position it around your neck and below your ears. Straps must not be twisted. The sequence of applying straps can vary, but the end position of straps remains most important. Adjust for a comfortable fit by pulling the top panel toward the bridge of your nose and the bottom panel under your chin. Make sure that hair, facial hair, jewellery and clothing are not between your face and the respirator, as they will interfere with the fit. Place your fingertips from both hands at the top of the metal nose piece. Using two hands, mould the nose area to the shape of your nose by pushing inward while moving your fingertips down both sides of the nose piece. Always use two hands when moulding the nose piece. Pinching the nose piece with one hand may result in an improper fit and less effective performance. Place both hands completely over the middle panel. Cupping the hands, cover the front of the respirator with both hands, being careful not to disturb the fit of the respirator. Inhale and exhale sharply. If you feel air leaks around your nose, readjust the nose piece as described earlier. If air leaks around respirator edges, adjust panels and position of straps and make certain respirator edges fit snugly against the face.
Key points I want all of you to remember. Ensure there is no hair between the mask and the face. Tie back any long hair and a clean shaven face is required as appropriate. Make sure that you are performing hand hygiene before accessing your mask so your hands are clean. Ensure a snug fit. Mold the nose wire to the shape of your nose and face. And every time you put on a mask, you need to fit check it. That is where you inhale sharply and look for the collapse of the mask, and exhale sharply with your hands placed around the edge of the mask, feeling for air leaks as you exhale. If you do feel any air leaks, try adjusting the mask and remolding the nose piece once more. Okay, now we're going to move into fit testing. The aim of this is to be able to find you 1 to 2 masks which fit your face well and provide you with the best protection. It is an assurance that the mask you are wearing is working correctly and protecting you. We'll use a hood, as you can see in this picture, and spray a fine mist of either a sweet or a bitter tasting solution. With a well-fitted mask, you'll be unable to taste the solution at the end of the test. You'll be also asked to perform some actions while completing the test, and for this you just need to follow the video. It's just examples of moving how you normally would with a mask on, so moving your head, moving your body a little bit. If you have any questions or any concerns, please ask whoever's testing you on the day, and we'll talk through those with you in person.